Welcome to the webinar, Minority Serving Institutions in Global Health. This webinar is brought to you by the Consortium of Universities for Global Health and North Carolina Central University. I'm Dr. Jessica Everett, and I'm very glad to be moderating this session today. We have a wonderful lineup of speakers that I'd like to introduce to you. Our first speaker, and really the visionary and organizer behind this webinar, is Lahoma Rumaki. Lahoma is a health communications specialist. Her experience includes managing complex statewide, national, and international public health programs, as well as teaching public health courses. She's an associate professor at the North Carolina Central University, and she is a member of the CUGH Competency Subcommittee. We are also joined by Angelina Gordon, who is the Director of Communications, Outreach, and Diversity at the USAID Global Fellows Program 2. Angelina oversees the communication and inclusion strategies that demonstrate USAID's leadership in workforce development. She leads the project's outreach and diversity efforts by producing multimedia products for key audiences, including communities underrepresented in global health. Angelina previously served as Knowledge Management Specialist for USAID's Feed the Future Global Initiative, as well as Senior Specialist in Knowledge Management and Documentation at Save the Children. Welcome, Angelina. Next, we have our speaker, James Hamm. James is the Deputy Country Coordinator for the CDC Center for Global Health Division of Global HIV/AIDS and TB for Côte d'Ivoire. James is in addition to being at the CDC, James has had a career of over 30 years in federal government experience. He served as Deputy Director for Management and Operations for the CDC program in Lusaka, Zambia from July 2011 to August 2015, as well as Deputy Director for CDC Côte d'Ivoire from 2009 to 2011. He was also Peace Corps Country Director in Cameroon from 2007 to 2009. Welcome, James. And I'm Dr. Jessica Everett, Chair of the CUGH Competency Subcommittee, as well as Executive Director of Child Family Health International and Clinical Professor at UCSF in the Department of Family and Community Medicine. Our first speaker will be Lahoma. Welcome, Lahoma.
Yes, thank you, Jessica. Good afternoon, everyone. My name is Dr. Lahoma Smith Rumaki, and I'm pleased to be among the panelists for today's discussion on MSIs and global health. My colleague here at NCCU, Dr. Mesker-Jones, and I have been looking at this issue for a couple of years because we were concerned that we were not seeing students who were signing up for what we consider to be tremendous opportunities for inclusion in the global health workforce. Before I proceed, I would like to thank Keith Martin, the Executive Director of CUGH, along with the staff and colleagues, Jessica Everett from other institutions who have been very supportive of this work and who are leading wonderful initiatives at their own institutions. I would like to stress that some of the ideas and work that I will present today is a compilation of findings as a result of the efforts of perhaps many on this call, as well as the interests of stakeholders and those with vested interest in promoting best practices for including minority students in the global health workforce. Next slide. So I want to begin with the evidence that shows that students need to have international and cross-cultural experience as part of the 21st century resume. This quote that I saw included from staff from the Institute of International Education, and I think it represents really well the idea that students who study abroad really get that extra boost, that extra help in terms of looking beyond their college career. There is evidence that students who study abroad do demonstrate higher grades after the experience, and they have higher graduation rates, in addition to the other social, cultural, economic benefits that they incur from such a rich experience. And lastly, reaping the benefits for career opportunities. At NCCU, however, we were a bit disappointed that there were clearly many benefits, as I just outlined, to study abroad and having these international experiences. However, our students were simply not signing up. And as we started talking to our colleagues at other MSIs and other faculty members, we kind of noticed the same thing. So we began to, the slide that you're looking at, we began to look at just the bare numbers of students who study abroad, U.S. students who study abroad over the past few years. And you'll notice that 17 million students are enrolled in 2-year and 4-year institutions, and of that 17 million, about 313,000, the most recent estimates from Open Doors, the IE reports, show that the number of students who study abroad. And then primary fields that are represented are those in STEM, and that's including engineering, math, and the physical life sciences, as well as the health professions. So you see the 23.9% representing the percentage of that 313,000 who study in that area, and then you see business and management students as well as the social sciences. Next slide. What was of particular concern to us, though, even though the 313,000 students studying abroad might seem like a large number, when we started to look more deeply behind the data, we saw that the students were not studying abroad in proportion to their racial and ethnic makeup. Here you will see that although African American or Black students make up approximately 14.9% of students engaged or enrolled in post-secondary studies, that they made up a much smaller 5% of students who study abroad. Compared to Caucasian or white students who are enrolled at 60% of students in post-secondary education, but make up more than 76% of the students who study abroad. Next slide. This slide represents the fact that if you look at the regions more closely, you will see that the majority of study abroad visits are to the European region. And so although this doesn't say a lot in terms, it doesn't answer a lot of questions, it does make us ask ourselves perhaps if this had something to do with the number of minority students studying abroad. Next slide. So we then, to summarize, there is a significant gap in the profile of those who study abroad, with minorities falling significantly behind their white counterparts. This results in their limited ability to gain, certain competencies, particularly cross-cultural competencies and linguistic skills that would make them competitive for entry-level global health positions. Likewise, they do not acquire the skills that would make them particularly competitive for international fellowships and internships and volunteer opportunities across the spectrum, therefore leading to underrepresentation of U.S. minorities in master's programs and doctoral programs, as reported by CUGH in a recent report. Next slide. So this webinar presentation is focused on MSIs with the understanding that about 42% of minority students do attend majority institutions. And so while we understand that a great number of students attend majority institutions, we wanted to look specifically at MSIs as a place that offered some unique opportunities and challenges that might help us increase the number of students that we are preparing to make competitive for a global health workforce. Next slide. So MSIs are two-year and four-year minority, two-year and four-year institutions, that encompass all of the different institutions that you see listed here: HBCUs, TCUs, PBIs, HSIs, et cetera, et cetera. And depending on the source that you check, we know that the number of minority serving institutions are tremendous. In one source, we documented 1,254 institutions. In another source, they were listed as 596. So we are not working with a definitive list of MSIs, but they do encompass the all of the institutions and institution types that you see presented in front of you. Next slide, please. So our question basically is, what are some of the factors affecting the participation of minority students in study abroad activities that then will lead to global health careers? Next slide. So there are a number of opportunities, clearly, that we think that MSIs offer. First, we are aware of the changing demographics in the U.S. and that as we become more racially and ethnically diverse, that we are clearly going to be faced with larger numbers of students who are part of the U.S. population. MSIs are smaller and they're usually reach out to low-income and underrepresented communities, which are representing a lot of the areas where students would like to study abroad. We also know at MSIs we have a very diverse faculty with role models, and that the focus on enhancing and cultivating leadership through the students is a key focus of our institutions. But that said, there are some challenges that MSIs uniquely face. Some of the ones that were highlighted in particularly this source, Creating Global Citizens, Challenges and Opportunities for Internationalization at HBCUs, include resource constraints, which is the one challenge that we constantly hear, a lack of senior leadership and understanding about the importance of study abroad, clearer policies and consistent policies that would allow students to study abroad, and then a long-term versus a short-term vision. Basically saying that, you know, it's fine to go on one trip, but that sometimes our universities lack a longer-term vision and strategy for maintaining students on a consistent basis. Next slide. In this report from the University of Penn Center for MSIs, some of the challenges that they found, again, it was financial, that students are concerned about the cost of studying abroad, but we also found family and parental attitudes may negatively impact students' anxiety about travel, including some concerns about meeting racism outside of U.S. borders. And that corresponds certainly with the lack of identity with program locations. There are faculty challenges at MSIs, particularly with heavy course loads and their commitments for a number of other responsibilities that we don't necessarily see at larger institutions. And of course, for faculty leading programs, the cost and resources can be a barrier. And then lastly, for institutions, making sure that students have meet the requirements of the curriculum while also including the study abroad programs. Programming and scheduling difficulties have also been noted. Next slide. So when Dr. Mesker-Jones and I talk to our students here at NCCU, I can strongly endorse the findings that I've seen from other reports that students do see a value in study abroad. Here, there's a quote, so you can connect with different cultures, going to other countries, coming back with that experience. So we want to emphasize that we think that the students at the MSIs, based on the data, are very aware that this is an important experience and that this is an experience that will help them in terms of their overall career goals. Next slide. However, the challenges for our students here at NCCU mirrored the ones that were found in the previous reports that I just shared. There were financial concerns. There were a lack of knowledge about the different types of programs. There was fear linked to, again, racism, linked to the fact that they were not familiar with many of the places, and that was proved to be overwhelmingly a challenge and a barrier that they just could not move beyond. And then lastly, the lack of mentors and networking. In conclusion, I would just like to say that minority students do appear to be interested in global health careers, but they are not participating in large enough numbers in activities that will put them on the trajectory for a global health career. And that continued barriers around some of the barriers that you see and that you hear include funding and lack of knowledge about opportunities and lack of mentoring and support to network and pipelines for internships continue to be there. There is this common refrain to the 4 F's, fear, family, finances, and the lack of flexibility, as well as the 6 C's, the cost, competition between campuses, the curriculum, competencies, course loads, and commitment of faculty. Next slide. And so our recommendation is that we need to continue to engage faculty and administrators as mentors, and there have been a number of very successful activities to do that, to integrate global health projects into the curriculum and service learning activities. We need to update our curricula and make sure that students, that we're not delaying students from being able to graduate on time, which was also a concern. We have not made that clear connection that students can, it's not either or, but they can do all of, they can do it both. They can study abroad and still graduate on time. Next slide. We should also develop relevant coursework and summer institutes for undergraduate students, and strengthen our partnerships with other universities to increase opportunities for collaboration at the local and global levels. We have here at NCCU been very pleased at the collaboration with institutions who are close by. Our institution, Duke University, and the University of North Carolina at Chapel Hill, which have allowed us to provide opportunities for our students to study abroad, and that is a very important collaboration and partnership that we would like to continue and that we encourage other MSIs to consider. We certainly need to conduct more interdisciplinary efforts. As I showed the first slide, there are a number of business students and social sciences students who are pursuing study abroad, and incorporating those in interdisciplinary efforts is a way to increase the number of students who study abroad. And then lastly, to target specific fellowship and scholarship efforts to minority students. And then my last slide is to, as looking forward, there are a number of different initiatives, the White House Initiative on HBCUs, for example, through their International Affairs Subcommittee, have looked very closely at increasing the number of minority students who pursue international careers generally, and then global health specifically. The Council on International Educational Exchange and their work with the University of Penn Center for MSIs. We know that the American Council on Education and the U.S. Department of Education have been working to to create Global Citizens, which aptly defines the title of the document that they created, as well as the Institute of International Education and their Generation Study Abroad, where they're looking to really increase the number of students, not just minority students, but the number of students overall who engage in global health activities and study abroad activities specifically. We would also like to encourage HBCU and MSI alliances and appreciate the work that CUGH, again, is doing in this area. So that concludes my talk. Thank you very much, and I look forward to your questions.
Thank you, Lahoma. Here is Lahoma's email. She's been gracious enough to give you both her email and phone number, so hopefully this webinar will lead to further collaborations and moving things forward. And again, thank you to North Carolina Central University for sponsoring this important webinar. Next, I want to bring the spotlight to Angelina Gordon. Angelina, as I mentioned earlier, is the Director of Communications, Outreach, and Diversity for USAID Global Health Fellows Program 2. Welcome, Angelina.
Thank you, Jessica. Good morning, everyone, or good afternoon, depending on where you are. Lahoma's presentation resonates so deeply with us. A lot of the recommendations and also challenges that she outlined and highlighted for us have really been the collective work and the collective sort of thought leadership for us stemming from USAID and other implementing collaborators like CUGH. So part of my presentation is going to hopefully speak to some of the work that GHFP2 is doing to close some of those gaps or inequities and overcome some of those barriers for minority serving institutions, students, or diverse students wherever they may be. So GHFP2, the Global Health Fellows Program 2, is a USAID, United States Agency for International Development funded program. As Jessica noted, we work in workforce development, specifically within global health, and we have two mandates: to identify, recruit, and support diverse global health professionals, so people who can join the workforce immediately, and also to build the next generation of global health professionals and leaders, so that capture the top hashtag NextGenGH is where I spend the bulk of my time and where we have dedicated a lot of our time and resources as a program in partnership with Global Health Corps, GlobeMed, Pixera Global, and Faces for the Future Coalition to really create activities and tools to introduce minority students in underserved, underrepresented communities and early career professionals, give them avenues and access to additional career study, academic study and career opportunities within global health. So for this presentation, in addition to our workforce development programming, we also look really deeply and partner trying to find ways to support these communities to gain access. And a lot of this work for us takes the shape of a variety of research studies, summits that we do in collaboration and partnership with USAID and other leading entities like CUGH and the White House Initiative on HBCUs. We also author blogs and articles. We create modules and materials, a lot of which can be found on our website. Next slide, please.
Angelina, your volume's a little low. Maybe put your mic a little closer to your mouth. Thank you.
Sure.
Thank you.
So as I said, the vision for our program is to create a diverse group of global health professionals at every stage, so early, mid, and more senior level careers. And to that, we really want sort of leveraging USAID's thought leadership to create a global health workforce that mirrors the American public. And that's really the foundation from which we identify and recruit and then support global health leaders and professionals. And this work is really reflected in our outreach efforts, which are largely at minority-serving institutions like HBCUs, Hispanic-serving institutions as well, but also, as Lahoma was mentioning, with PWIs, with primarily white institutions, which have strong communities of students of color. And so our recruitment and hiring practices really form the foundation by which we engage some of these communities, and also all the way through their professional and career support that we offer our fellows and our interns. And just for a quick, clear distinction, our fellowships are 2 to 4 years, and our internships are up to 1 year, and they're both paid and paid jobs with USAID. Next slide, please. Thank you. So as I mentioned earlier, the program takes a lot of effort and really passionately loves and feels deeply about building the skills of our next generation leaders, global health leaders, and the bulk of that work is around building an inclusive workforce. So we've done a few research projects, namely an employer study and also a study looking at challenges and barriers for global health graduates entering the workforce to really understand what some of those gaps are and who is and isn't working in global health, what skills could be strengthened, what challenges that they're facing. And so the competencies or skills on the slide originate primarily from our employer study, which was a survey of about 50 global health employers nationally. And this information was published in the Annals of Global Health, which is a well-known research publication. So these are often called soft skills, but what we want to really impart is that these are the non-competent, non-technical competencies, the skills that employers say they really want their incoming professionals to have more of. These are the ones that they find the most critical to doing the job well, especially when you're talking about global health, when you're talking about working with diverse communities, with internationally based communities at times. So looking at their ability to work within teams and collaborate well, which is interpersonal effectiveness and the ability to listen as well as communicate. Strategy and project design, communication with each other as well as communication with other departments or teams or groups, and also with your client or your donor. For us, that would be USAID. Monitoring and evaluation also ranked pretty highly. Can you analyze the data and the information, and how does that inform the interventions that you're doing? And then program management, how do you sort of bring it all together and take a bird's eye view and manage the individual pieces? Next slide, please. So GHFP2 in both of our two mandates and fostering a diverse next generation of global health leaders and professionals, and also in identifying and recruiting and supporting global health leaders. We are creating, with USAID's leadership, a global health career pathway. And at the start for that, for us, is our partnership with an organization called Faces for the Future Coalition. It's based in California. And they work with underserved, underrepresented, diverse, so minority high school students. Because we know through research and experience over the last several years that really starting to advocate for a global health career and starting to sort of create that trajectory really starts early, and high school and undergraduate, etc. So for the past several years, we've partnered with Faces for the Future Coalition to develop a global health career pathway for underrepresented youth. Recognizing that a lot of these students go on to matriculate to community colleges and then to minority-serving institutions, if not directly into minority-serving institutions. And really our work together is in 4 sort of service areas, which will echo the barriers and the challenges Lahoma mentioned earlier. So first is global health career exposure. Letting them know that USAID and other implementing partners are an avenue for them to leverage their skills, their unique skills, given their backgrounds, language skills, etc. Our second sort of bucket of work is in academic support and college preparation. Third is life skills training and case management. And then the last is probably the most important part because it underpins the rest of it, and that is youth leadership and development and support, that mentoring, that engagement with them on a regular basis. Because our goal really is to expose youth, starting at the high school level, to careers in global health, and modeling and shaping their educational development around that to inspire them to make it through a master's degree program and enter the global health workforce. Next slide, please. So the next step for us, the next step level up, if you will, is working with undergraduates and graduates. And so that, for us, continues our pipeline or pathway approach with GlobeMed, an organization based in Chicago, Illinois. And so we partner together to develop student-run global health chapters that are based at schools and colleges and institutions across the country. And it's similar sort of programming. We do skills building, we do leadership development, we do mentorship, we look at disparities, inequities, and social justice issues that make their way, because it's all connected, into the global health workforce. And so to address some of these inequities in access to international internship opportunities and the sometimes stiff requirement of having a master's degree to enter the global health workforce, as it is with our funder, USAID, we work with GlobeMed to also facilitate overseas internship experiences for undergraduates. And those have a particular focus. We focus particularly with students at MSIs or students of color at primarily white institutions. And so these internships typically pair a student or a group of students with a grassroots global health organization in Africa or Asia or Latin America. And we found through this internship experience, which is typically about 12 weeks, they gain really key cultural knowledge and understanding, and they have experience in interpersonal collaboration and teamwork. They gain some of those soft skills and those competencies that we talked about earlier, which really help propel them into a dedicated, successful future global health career. So to date, we've worked with about 58 university-based chapters with GlobeMed, and that's translated for us to about 6,000 undergraduate students. Next slide, please. So the next level up from that, from the programming side, is outreach. And like I mentioned earlier, our diversity programming, our diversity initiative, is really the foundation by which we do all of our work internally or with partners. And our outreach efforts are really no different. Our outreach efforts work in tandem with our recruitment and our hiring practices to ensure that we really have the most diverse, dynamic group of professionals to tackle global health challenges around the globe. And so a few of those best practices that we've developed over the years are recognizing that MSIs are a huge community of strong leaders, global health leaders, who really benefit from in-person engagement and collaboration. And so we do go out to those universities, those institutions, to talk with students and faculty to identify gaps in training, but also to support them and let them know that, hey, this is an opportunity for a career pathway for you, and also here are some resources and some tools and training opportunities that you might take advantage of to have a holistic approach to your professional development. So over the last several years, we have gone to conferences, consortium conferences, large global health annual conferences like the Consortium for Undergraduates in Global Health, CUGH's, American Public Health Association's annual conference, the ABRCAM's conference, which focuses on minority students in STEM, and also HACU, which is the Hispanic Association of Colleges and Universities annual conference. And so through September of last year, we've reached out to just under 11,500 individuals, diverse individuals at some of these events and institutions around the country, and thus far have done about 150 outreach events going specifically to these places to engage with students and faculty. Next slide, please. So given that we have a key focus on engagement and support of diverse global health leaders and professionals, we really continue to develop resources and tools to both increase students at MSIs and primarily white institutions access and interest in a global health career, but also leveraging our professional and career development and support staff here on the program to support those professionals as they enter our program as a fellow or an intern, to really make sure that we are covering some of the dynamic and unique challenges or opportunities that they have to continue their work, continue their program, their career pathway rather. And so one of the resources that we have up on the screen is a toolkit on how to pursue overseas opportunities for students based at MSIs. GHFP2 also offers some really dynamic and free support services like informational interviews, which is essentially career planning. You'll meet with somebody on the phone and we'll go through your resume with you and sort of help you map out what the next steps might look like. The same with resume tips, how to build the best resume that is going to help get you that job. We also offer webinars like this one and others that we've hosted on our YouTube channel. And we also have a variety of networking events that really, again, engagement and support services to really make sure that we're fostering the best access and entry points for minority serving institution students and diverse candidates. Next slide, please. And so just to wrap up, we would love to continue this conversation with our panelists, my fellow panelists, as well as with all of you listening. And so please engage with us. We have a variety of ways to get in touch: Facebook, Twitter, LinkedIn, Instagram, Flickr, etc. This is a really critical and important conversation to have, and anything that we can do to continue to build the resources and tools that we have and plan new activities, new dynamic activities, we would love to partner with you. So thank you.
Thank you so much, Angelina. That was amazing. And please take note of all these resources. We will be sending some links out during the discussion section, but certainly Global Health Fellows Program 2 is something to follow closely. Next, we have James Hamm, Deputy Country Director of Côte d'Ivoire from the CDC. Welcome, James, and thanks for joining us.
Thank you. Thank you for having me. And thanks for everyone for participating. My name is James Hamm. I'm the Deputy Country Director for CDC. And I thank my colleagues for talking about the study and about the activities available through Global Health. But I want to talk a little bit about what CDC does. So bear with me as we move forward, and I know we're moving a little bit fast on time. Next slide, please. So CDC protects the American people 24 hours a day, 7 days a week, from health, safety, and security threats around the world. And we use scientists, our experts that are embodied around the country and around the world. Next slide. So as you can see, CDC has been working in global health for over 50 years. We provided domestic and global public health leadership all over the world to achieve the public health goals and meet emergency challenges that are dealing with health outbreaks around the world. CDC started in about 1958 when they developed the Foreign Quarantine Service to join CDC and be able to respond to initially some smallpox and cholera outbreaks in South Asia. Then we moved toward a global eradication of smallpox in 1979, and as you can see from the chart there, that outbreaks started to become a problem around the world, all the way from polio to SARS to H1N1 bird flu, and then recently Ebola in West Africa, and now Zika in Brazil. Next slide. CDC has made it a priority and has been one of the agencies that has prioritized to really encourage people, especially students and potential applicants, to really pursue careers in global health. And they've listed out 5 reasons why it's important for you to be able to pursue a career in global health. 1, national security interests. It's important for our people to get abreast and be informed about some of the ways that you can join the U.S. government in helping protecting outbreaks around the world. As I indicated in the previous slide, outbreaks are continuing to emerge, and we have to continue to have a ready, available workforce to be able to be equipped and prepared to be able to respond to the outbreaks that are happening. As I listed before in the previous slide, that we had Zika, SARS, Ebola, and H1N1. The second reason we note that it's important to pursue a career in global health is that you can be the one to help us be able to strengthen our countries and our world through prevention, through protection, and through responding. Third, one of our key points is health diplomacy. As I indicated, we've been doing this for over 50 years. And health diplomacy is very important in that CDC's work protects the United States from public health threats and reduces poor health overseas, leading to a more productive and healthier people, as well as a stronger, self-sufficient nation that helps create economic opportunities for the American exports and job creation. I touched on points 3 and 4, but lastly, I think it's an outstanding thing to do. And I'll tell you a little bit more at the end on how I got started here in global health. Next slide, please. CDC brings global expertise in about 5 areas. Surveillance and strategic informations. We use detection and global mapping to be able to provide research and resources for the CDC and our U.S. government partners to be able to follow and detect and be able to communicate outbreaks around the world. And we continue to do that with translational implementation and operational research. CDC has a large facility in Atlanta, as well as a lab that is critical in being able to help us be able to research and interpret data and information that we detect around the world. We bring a strong public health workforce. Our staff are composed of research analysts, project managers, doctors, biologists, epidemiologists, to be able to help with the overall public health emergency response. Next slide, please. So CDC's global health strategy is we want to have a world where people live healthier, safer, and longer lives. We can't do that if we don't have any way to be able to combat outbreaks and diseases and around the world that can impact and impede upon our borders. So we do that through health impact and health security and health capacity. We look to improve the health and well-being of everyone around the world. And we can only do that by building the capacity of our staff members and the world that we interact with. Next slide, please. So on this slide, we have, a list of public threats that have evolved. It started with the emergence of and spread of new pathogens, global travel, food and medicines, resistance of the rise of drug resistance, and intentional or engineering or accidental release of different species or pathogens. In 2001, we had the anthrax threat of 22 cases that were identified where we had 5 deaths. Then in 2002 to 2003, we had the SARS outbreak, where over 8,000 cases were identified and where 77 people passed away. Then in 2001, we had the outbreak of the bird flu, where about 43 to 89 million cases were identified and over 250,000 deaths. Then in 2014 and 2015, I'll say it continues to today, that we had the threat of Ebola, where over 28,000 cases were identified with 11,000 deaths. So as you can see, we continue to have public health threats, and we need personnel and a workforce to be in place to be able to continually combat and be able to prepare for and respond to those continuous emerging threats. Next slide, please. So CGH, the Center for Global Health, is divided into 4 divisions. We have HIV, TB. We have a division of parasitic diseases and malaria that focuses on and receives funding through the Presidential Malaria Initiative. We have our GID, our Global Immunization Division, and we have our Division of Global Health Protection that is overall responsible for the overseas security portion of the CDC portfolio on outbreaks. Next slide, please. So as you can see from this slide, CDC has over 1,700 staff working in 63 countries. These are staff who are overseas assigned to both the U.S. embassies and international organizations. And the ones in blue are where we provide some technical collaboration. Next slide, please. So from this map, you can see where CDC has a global presence. I won't speak much about this, but from the legend on the left, you'll see our different divisions and where they're interacting around the world. This continues to evolve, has evolved over the years. And you can see that CDC's yearly global budget has been almost about $3 billion. Next slide. So as I indicated, I am the Deputy Country Director over in CDC in Cote d'Ivoire. And we are pretty much our staffing footprint or our program footprint is exactly like this one is for CDC Nigeria. We promote a One Health program that focuses on all of our efforts and resources in our health portfolio. So we have the Global HIV/AIDS portfolio, the President's Malaria Initiative portfolio, global immunization, the field epidemiology training program for local doctors being able to build capacity for residents in that country, as well as the global health protection. Next slide, please. CDC doesn't do this alone. You know, we will not be able to do it alone going forward. You can see through this list of partnerships, both USG, philanthropic organizations, NGOs, as well as UN organizations, the private sector, academic institutions, as well as the ministries of health. This is a world collaboration needed to be able to continue this fight in global health protection for our world and for our country. Next slide, please. We not only do it with organizations, but we do it through partnerships as well. Next slide, please. Okay, how did I get here? Unlike Dr. Lahoma mentioned earlier about the study abroad programs and experiences, I started out in the U.S. Navy and had my eye open to opportunities abroad through traveling from different ports in different countries. Then I decided to go to college and enrolled at North Carolina Central University as an education major. Never knew that I would explore an opportunity and career in the Center for Global Health. I got recruited as an education major to join the U.S. Peace Corps. And from there, that was my study abroad opportunity. I had the opportunity to be able to teach in a small village in West Africa in a country called Guinea, where I learned French and cross-cultural skills and working with people at the grassroots levels in projects from education to health to small business opportunities. This was an eye-opener for me and showed me the world as it was outside of my boundaries in the United States. Once I finished my 2-year commitment, I decided I knew I wanted to go back abroad. So I came back home and pursued a graduate degree in education, which I thought I wanted to come back and overseas and be a principal at an international school. But I wound up joining Peace Corps and getting selected as a country director. From there, it opened up my career path. So for the record, I am not a doctor. I do not have a MPH, Master's in Public Health. But my career has evolved into leadership and global leadership. And from there, I got recruited to join the CDC, leading their portfolio of management and operations. CDC has doctors, research, epidemiologists, medical officers, etc. But my portfolio is mainly to be able to provide oversight and management of our overall our management portfolio. So I'm going to stop right here. I know we've had some time so that we can have some time for questions. So I'll turn it back over to Jessica.
Hi there. Thank you, James. Thanks so much. Thank you to Lahoma, Angelina, and James again. I want to kick off the discussion with a question about local global health. Local global health, for those of you listening that may not be familiar with the term, is global health that's in our own backyard, so wherever you may be located domestically, rather than thinking about working internationally in a different setting. And I wondered if our presenters might comment on the relevancy of MSIs and people of color for local global health service, research, and education.
Hi, Angelina. Why don't you take that?
Thanks, Lahoma. Local is global is one of the underpinnings of our work with more than one of our partners. We really do sincerely believe and have research that proves that the issues and the instances that we see in our own backyards, like in Oakland, California, where Faces for the Future Coalition is based, really do have the same challenges that you would find in Latin America or Sub-Saharan Africa. And so GHFP2 through Basis for the Future Global Basis for the Future Coalition and also Global Health Corps, the younger Barbara Bush's foundation and organization, really do try to one, make that known, make that sentence and that statement known, and then also supply our young and early career professionals with skills and competencies and experience working with local communities and take out into the country, into the country, like in Africa or Asia or Latin America. The Global Health Corps model, for example, pairs an early career under 30 global health professional with usually a sub-Saharan African-based professional for a 1-year service learning and skills building and mentorship volunteer experience, usually in country. So making that case that global is local is also a conversation that we're having directly with USAID because it does absolutely affect hiring practices. Who is able to apply for a USAID technical advisor position or apply for a fellowship or an internship position with us outside of having to have a master's degree? USAID and a lot of the other implementing partners really do stress and require in some places that you have an international global health experience or some international volunteer experience. And we know in Lahoma's statistics and that information was really helpful in notating and underscoring that the access points, the entry points aren't equitable for each sort of population within the country. So this is one of the ways that we're trying to not only shape and inform that conversation on the donor side with regard to their hiring practices, but also try to narrow that gap and lessen that barrier for minority and diverse communities.
Thank you so much. Our next question comes from Kaylin Agnew, who is a newly graduated Master's in Global Health student from UCSF. And Kaylin asks, given the current political climate and the executive order that was signed by the current administration that put limits on family planning and abortion counseling and canceled the CDC's Climate Control Summit, what are your thoughts on the job outlooks under the current administration for the next 4 years in global health, and how do you mentor, recommend young people like Kaylin think about and look for a job? Kaylin notes that he's having difficulty finding a job currently.
I'll speak to that question. Yeah, there was a recent, I think President Trump recently signed a hiring freeze, White House guidance on the U.S. government hiring until further notice. But the U.S. health portfolio, CDC, and activities that are heavily engaged in health around the world is not impacted in this, along with the military. CDC is ripe for applying now, as there are opportunities, and there's an attachment that will be shared here on the site. But there are, depending on where your start level is, your experience, or if you're coming out of college, or you have a medical degree, MPH, etc. There are opportunities for you to be able to start via fellowships or internships, and I would recommend that even they start with just some informational interviews to see, what CDC really has to offer. We have about over 17,000 employees that are working both at headquarters and in the field. So I think the opportunities that are pretty ripe right now for them to be able to pursue opportunities within CDC. Several people come through what they call the Alan Rosenfeld Fellowship that really works to place students around the world working with CDC operations in U.S. embassies and with our UN partners as well. People also come in, have made a practice of coming in through what they call the Presidential Management Fellows. We have several employees who have gone through that opportunity and taken advantage of that opportunity. I myself came in directly from Peace Corps, as I indicated, and they had special programs to be able to recruit returned Peace Corps volunteers, certain waivers and processes, given that they had some overseas experiences. So CDC is really looking for those kinds of qualifications, those who have worked abroad, those who can speak another language, those who have strong interests. I would also want to share with you that CDC has what they call the United States Uniformed Service Corps. We call them the United States Public Health Service. They are uniformed officials who are like military, but they focus directly on global health.
Hi, and this is, I know we've run out of time, Jessica. I just want to say, and that we here at MSIs and just faculty in general, as we think about Caleb's question, which I think was an excellent one, we should just remember that the need is still great, and that the opportunities will continue to present themselves, and that we have a responsibility, and we have a responsibility to continue to prepare ourselves for, and I'll go back to the way I started this, for what is really needed to operate and to be successful in this 21st century world.
Thank you, Lahoma. I want to take one more question. I know we're running a little over, but I think this is a really important one. John Jaramillo asked, as it relates to racism abroad and anxiety that students of color face, how can we better prepare students for these particular challenges that they might face that is distinct from those of their white peers? How do we recognize these particular challenges and talk about them openly in an academic setting?
Okay, this is Lahoma again. This comes up a lot with my students, and I think that's just very important to acknowledge and prepare students for it. I will never forget the responses of some of my students when they're, whether we were traveling in Africa, where kids would call students of color white, or whether they were in Europe where there were other names that they were called. And so I think just being very upfront and open and making sure that the faculty member or the coordinators of the trip remain open to these conversations and having them before the trip, but making sure that they understand that certainly that should not taint the entire experience, but we should also not minimize the fact that they may encounter racist attitudes just as they may, walking to their local grocery store in their hometown. So it's not to run away from the conversation, but confront it and be very proactive in how you help the students, not just the minority students, but all your students, think about it and be proactive in discussing it.
Thank you, Lahoma. I'm going to end with a comment from and a question from Leanne May. Leanne says, I currently hold an MPH from the University of Cincinnati and have had a broad experience. I would love to do more in global health, but I feel so lost. Been having difficulties looking for a job in that field. Where should I start? Where can we connect with a mentor? I want to emphasize the handout that's in your control panel for CDC internships and fellowships, as well as the offerings of the Global Health Fellows program too. Angelina, can you just remind everyone on how to access the informational interviews and the resource guide and everything else that you offer?
Sure. It's really one step. Just go to ghfp.net. At the top right of your screen, you'll see sign in and or apply. And if you click apply, you can sign up for one of our informational interviews or apply for a fellowship or an internship, which if you scroll down to the middle of the page, you'll see which ones are listed and available for applications.
Wonderful. And I want to encourage everyone on the webinar to consider membership in the Consortium of Universities for Global Health. This is a wonderful network of faculty as well as students and young professionals who are dedicated to evidence-based global health, research, education, and practice, coming from both academic and community-based settings. Your institution can join as an institution or you can join as an individual, and there's a sliding scale fee structure based on whether you're in high, middle, or low income settings. So please join CUGH, and thank you again to our sponsor, North Carolina Central University, and to all of you on this important webinar. We will continue going forward together and making the world a better place. Thank you and take care.